Welcome to the Local Anesthesia Clinical Examination Review. This presentation is intended to familiarize you with the exam process and paperwork prior to attempting the examination. It is to your benefit to read and familiarize yourself with the information provided in the candidate manual. Being well prepared consists of understanding the policies and procedures of the examination. The candidate manual and examination forms are available for download via the adextesting.org website. Downloadable forms are for reference only. Original forms are provided at the exam site for use during the examination. A list of required instruments and supplies can be found in the candidate manual. However, CDCA REBCTA does not provide instruments or equipment for candidate use. Do not assume that all exam sites have extra instruments or equipment available for use or for rent. Refer to the site info sheet available at adextesting.org for site-specific infection control policies, school-provided supplies, equipment availability, and more. Contact the exam site host school directly with any questions you may have pertaining to information contained in their packet. CDCA REBCTA hosts pre-exam webinars for students and faculty. This is a great way to learn about the exam process and have your questions personally answered by CDCA REBCTA staff. Candidates who attended a webinar say they feel better prepared for the examination. Educators and non-student candidates may contact us via the adextesting.org website to join a scheduled webinar. A clinic tour is conducted prior to the on-site question and answer session. The tour is optional. However, it would be beneficial to attend if you are unfamiliar with the host school or clinic layout. Specific infection control and sharps disposal policies, location of supplies, and emergency protocols will be discussed, as well as instructions on how to properly set up your operatory. During the tour, the school coordinator is available to answer equipment and school-related questions. On-site exam-related questions will be addressed by the Chief Examiner during the question and answer session. An optional question and answer session is held on-site prior to your scheduled examination. Here, the Chief Examiner will briefly review the examination processes, answer any questions you may have, and provide you with your candidate ID badge and an exam packet containing the necessary exam forms. Refer to your candidate manual for more information if you choose not to attend the question and answer session or the clinic tour. To save time, you may complete examination forms, with the exception of recording the patient's vitals, prior to your scheduled clinic entrance. Refer to the candidate manual for a list of applicable forms. Note that candidate use of electronic devices is strictly prohibited during any aspect of the examination, including the question and answer session or clinic tour. Examiners participate in examinations throughout the season. As the examination is administered by examiners, it is not anonymous. The Chief Examiner oversees the candidate clinic and upholds CDCA REBCTA policies and procedures to ensure a calm testing environment. The Chief Examiner and Flow Examiner answer exam-related questions and will address any problems that may occur. The Exam Technical Coordinator, or ETC, oversees the check-in and check-out processes to ensure that CDCA REBCTA policy and procedures are upheld. The ETC is also responsible for processing candidate retakes. A school coordinator is the school's on-site representative designated to assist exam personnel as needed. The school coordinator or someone familiar with school policies and equipment will be conducting the clinic tour after the on-site question and answer session. At clinic entrance and throughout the exam, you must be dressed in proper clinic attire and have your candidate ID badge visible. Bring your armamentarium and personal belongings with you. Mask, gloves, and protective eyewear is required. However, host schools may have additional requirements for personal protection. Loupes are acceptable in lieu of protective eyewear. Arrive at the exam site 30 minutes prior to your scheduled examination time. Take your patient's vitals and record their blood pressure and pulse on the patient medical history form. With exception of patient vitals, you may complete the medical history and consent form well in advance of the exam. It is your responsibility to submit a patient that meets the prescribed criteria as detailed in the candidate manual. The patient must be 18 years or older and cannot be a dentist, dental hygienist, or a dental hygiene educator. For the IA injection, at least one mandibular premolar must be present on the contralateral side of the submitted quadrant. For the PSA injection, the maxillary second molar must be present in the submitted quadrant. CDCA Reb-CETA adheres to these noted blood pressure guidelines. Preoperative blood pressure and pulse must be taken and recorded on the patient's medical history no more than 1 hour prior to your scheduled clinical examination time. The patient medical history form must reflect the patient's medical condition the day of the examination. Any yes answers must be circled in red. The patient initials the front of the form and completes and signs the back of the form. Any medical clearance documentation must be submitted along with your examination forms. Prior to the examination, complete the local anesthesia information sheet, with exception of the total amount of anesthetic administered, which is recorded after injections are performed. The completed form remains at your operatory for collection by the examiner. Once notified, you will be directed to your assigned operatory for setup. Your patient remains in the waiting area. No more than 2 loaded syringes may be present on the tray. A hemostat or locking pliers is also a required component of your armamentarium. You may have additional cartridges, needles, and syringes accessible but not loaded. Do not loosen needle caps until instructed to do so. An examiner will notify you when to escort your patient into the clinic. Place one of the provided candidate ID labels on the patient bib. At your operatory, an examiner will check the following: patient medical history and consent form and local anesthesia information sheet. 2 penetration sites. Landmark teeth are present. Syringe type, local anesthetic, and expiration date. Both you and your patient are wearing or have protective eyewear available. The examiner will direct you when to apply topical and when to loosen the needle cap. During each injection, there are 4 times when you must pause and announce each critical aspect of the injection. Your technique is evaluated at each critical aspect. After observing each critical aspect, one examiner will say, "I see," and the other examiner will state, "Proceed." Announce the position upon initial penetration of the tissue, then pause to allow examiners to observe the position. Announce when you have reached the optimum angle and depth. It may take examiners a few seconds to observe the angle and depth. Once you have been instructed to proceed, announce when aspirating and whether the aspiration is negative or positive. Pause to allow examiners to view the cartridge. The examiners may ask you to re-aspirate if they were not able to fully view the aspiration. Proceed and announce when you begin to deposit anesthetic. The examiners will observe and evaluate the deposition rate. After they have observed the rate, you will be instructed to withdraw. It is not necessary to deposit the entire cartridge since your patient is not being anesthetized for clinical procedures. Upon completion of the IA nerve block, either make the needle safe by securing the cap or immediately proceed to the PSA nerve block. After completion of both injections, remain at your operatory until instructed to dismiss your patient. On the local anesthesia information sheet, record the total volume of local anesthetic administered in milliliters or milligrams. This form remains at your operatory for collection by examiners. An examiner will observe as you dispose of the sharps and cartridges. Follow the exam site host's guidelines for processing unused anesthetic. Promptly remove all barriers, disinfect the operatory, and exit the clinic. It is not necessary to set up the operatory for the next candidate. Before leaving the examination area, Place your candidate exam packet along with any ITC forms and unused candidate ID badges in the designated basket. There are 9 aspects of an injection evaluated by examiners. Each aspect of the injection is classified as critical or less critical and must be performed to examination specifications. 8 critical aspects of the injection have an asterisk. One critical aspect validated by both examiners results in failure of the examination. Category 2, the less critical aspect of the injection, does not have an asterisk. 3 less critical aspect errors observed and validated by both examiners results in failure of the examination. Refer to the candidate manual for more information. It is your responsibility to submit a patient that meets the examination criteria. The patient must not have any medical contraindications for treatment. Refer to the Patient Criteria section of the Candidate Manual for more information. Errors in this category are the following: long-acting anesthetic, absolute contraindication to anesthetic vasoconstrictor, high concentration vasoconstrictor, using a self-aspirating or non-threading syringe. Only manually aspirating syringes are acceptable. Non-threading or self-aspirating syringes are not permitted for this examination. Any error in this section is injection-specific, with exception of orofacial herpes. Submitting a patient who has orofacial herpes will result in a failure of both injections. Examiners monitor for needle contamination after the needle has been uncapped. The needle should not touch any surface, facial or intraoral object, gauze or glove, prior to the penetration. Proceeding when the needle has been contaminated results in failure of the injection. It is not an error if the needle touches any intraoral anatomy, such as the tongue or cheek. Note that the hub may contact an extraoral or intraoral surface since it is not part of the needle. Penetration of the tissue is considered an attempt. You are allowed up to 3 penetration attempts per injection type in order to obtain the optimum angle and depth. You may stop and withdraw the needle at any time during the injection. However, you should inform the examiners prior to withdrawing the needle. On each subsequent attempt, the examiner will remind you of your attempted number. If unsuccessful in 3 separate penetration attempts, you will not be permitted to complete the injection. If the 3rd penetration attempt results in a first positive aspiration, a 4th penetration is permitted. Examiners will record an error for the IA if the penetration site is too superior, too inferior, too medial, or too lateral. Examiners will record an error for the PSA if the penetration site is too anterior, too posterior, or not in the mucobuccal fold. These images are examples of acceptable penetration sites for the IA and PSA. 2 critical aspects are evaluated under angle and depth category: the angle, location of the barrel of the syringe, and optimum depth. These aspects were evaluated once you announced reaching the optimum depth. If you touched bone prematurely, you may reposition the needle. Examiners will not evaluate your technique until you announce that you have reached the optimum angle and depth. For the IA angle, the barrel of the syringe must be positioned over the premolar on the contralateral side and the needle parallel to the occlusal plane of the mandibular teeth. The depth of insertion is 20 to 25 millimeters, which is approximately 2/3 the length of a long needle and 4/5 the length of a short needle. For the PSA angle, the barrel of the syringe must be positioned 45 degrees to the occlusal plane and at 45 degrees to the midline. The depth of insertion is approximately 1/2 the length of a long needle or 3/4 the length of a short needle. These images represent optimal angles and depth for the IA and PSA injection. For the IA, It is an error if the angle of the syringe is too distal, too mesial, too high, or too low. For the PSA, it is an error if the barrel of the syringe is not at a 45-degree angle toward the midline and or the barrel of the syringe is not at a 45-degree angle to the occlusal plane. It is an error if the needle is too shallow or too deep. In this slide, the hub of the needle is touching tissue, resulting in a needle depth error of too deep. In this image, the small window is toward the candidate, resulting in a critical error. Prior to aspirating, the large window must be toward the candidate. Upon aspiration, the examiners must be able to visibly see the stopper or harpoon move. Confirm that the stopper is engaged in the harpoon before you begin. Examiners will record an error if there was no visible movement of the stopper upon aspiration or when the harpoon is not engaged after aspiration is declared negative. For this examination, you are only required to aspirate on one plane. However, it is not considered an error if you aspirate on two planes. In this image, the harpoon is not engaged, resulting in a critical error. If you do not recognize the error and proceed with the injection, a critical error is incurred. However, if you recognize that the harpoon is not engaged, you have the option to withdraw the needle and re-engage the harpoon. The error is then evaluated under syringe preparation and handling. This is a less critical error and does not result in failure of the injection. A positive aspiration does not mean a failure of the injection. If you observe a positive aspiration, examiners will allow you a moment to decide how to proceed. Use your best clinical judgment when determining how to properly handle the situation. A positive aspiration not recognized or not handled appropriately will result in a critical error. These are examples of too much blood in the cartridge. The cartridge must be changed. Prior to the injection, a stopper width of anesthetic may be expelled to remove any large bubbles. Small bubbles may be present in the cartridge. Examiners will evaluate that no more than 1/4 of the anesthetic has been deposited into the tissue prior to reaching the optimum depth and before aspiration. It is an error if the rate of deposition is significantly less than 15 seconds for two stopper widths. Tissue management and patient safety are a critical part of the examination and observed throughout the administration of each injection. Any excessive manipulation or laceration of the tissue, bending or bowing of the needle, or disregard for the safety and well-being of the patient is improper tissue management. If observed, examiners will announce stop and hold. You are encouraged to use the type of recapping device that you are familiar with. However, recapping must be one-handed until the needle is safely inside the needle cap, after which you may use your other hand to secure the cap. These are examples of proper one-handed recapping techniques. Sharps disposal is evaluated after the completion of both injections. All needles and cartridges must be disposed of according to school policy. Refer to the site info sheet at adextesting.org for site-specific information regarding Sharps disposal policies. Improper Sharps disposal will result in failure of both injections. Syringe preparation and handling are less critical aspects of an injection. The following are errors in this category. You and your patient do not have protective eyewear. The required hemostat or locking pliers are not available. Expired local anesthetic. Anesthetic selection or needle length does not match the information on the local anesthesia information sheet. If you recognize that the harpoon is not engaged at the time of aspiration, you may withdraw the needle and re-engage the harpoon. An error will be noted for the following: harpoon not securely engaged, large bubbles not expelled from cartridge prior to the injection, expelled solution more than a stopper width, or the needle is not securely attached to the syringe. In this image, the needle is in the patient's direct line of vision. Examiners will stop any procedure that poses a health or safety risk to the patient by announcing "stop and hold." A stop and hold signifies that a critical error has occurred. When an examiner announces "stop and hold," you will be instructed to stop immediately and hold the position. The reason for the stop and hold is stated. If the needle has penetrated the tissue, you will be instructed to withdraw. If a stop and hold was announced for the IA injection, you will proceed to the PSA injection. The following are stop and hold errors. Long-acting anesthetic. High concentration vasoconstrictor is loaded in syringe. Absolute contraindication to anesthetic or vasoconstrictor. Candidate does not recognize contaminated needle. Small window is toward candidate upon aspiration. After penetration, more than 1/4 of the anesthetic is deposited in tissue prior to reaching deposition site for depth and angle. Stop and hold errors continued. No aspiration observed after aspiration is announced. Harpoon not engaged and candidate proceeds to deposit solution. Improper handling of positive aspiration. Rate of deposition too rapid. Improper tissue management. Improper recapping. Improper sharps disposal. CDCA REBSITA is a testing agency and not a licensing board. Successful completion of an examination does not constitute licensure in any state. It is illegal to render patient treatment until a license or certificate is issued by the state. Contact the individual state board or state-designated licensing authority for licensure information. Preliminary results are available on-site. However, finalized examination results are generally posted online approximately 72 hours after the last date of the examination. The local anesthesia performance evaluation form lists the specific criteria for each category of deficiency. Refer to the grading criteria listed in the candidate manual for all evaluated aspects of an injection. The retake exam is a separate examination attempt and included in the total number of examination attempts. Candidates who do not require remediation are eligible to retake the exam on-site. If you elect to retake the examination the same day, you will perform only the failed injection or injections. To secure a space in the on-site retake session, notify the exam technical coordinator. Payment is required to guarantee registration in the retake session. Once payment has been processed, a clinic time will be assigned and new examination forms provided. Retake exams are scheduled throughout the day. You have the option to submit a new or shared patient or resubmit your same patient. All the same patient criteria must be met for the retake injection. When a previous patient is submitted, the retake injection must be performed on the side opposite the initial injection. CDCA REBSITA utilizes an online post-exam survey to gather feedback from candidates about their exam experience. The survey is anonymous and all comments are reviewed. CDCA REBSITA values all feedback and would like to give every candidate the opportunity to comment on their examination experience. Thank you for choosing CDCA REBSITA for your examination. To ensure that you have a positive examination experience, please view this presentation as often as you feel necessary. If you have questions about any policy or procedure, or comments about this presentation, please feel free to contact the CDCA REBSITA office.